Hi everyone, I'm Dr. Nina Riggins and I am social media editor of the Journal of Cephalalgia and Cephalalgia Reports with International Headache Society. And today we are here with Dr. Ray. We congratulate Dr. Ray with graduation from amazing program with cephalalgia. She completed Cephalalgia Reviewer Academy for 2024-2025. And today we here not only congratulate Dr. Ray, but also learn about her experience and maybe get inspired for our future advancements and success of the program. So please, Dr. Ray, tell us a little bit about you. I know that you located right now in India in tertiary center and doing research and doing a lot of practical clinical work and also finding time to help headache community with reviews. Please tell us a little bit.
Thank you, Dr. Riggins. Thank you for giving me this opportunity to be a part of your great family of reviewers at Cephalalgia, and it's an honor for me. My name is Sucharita Ray. I work as a neurologist in PGIMER, which is Postgraduate Institute of Medical Education and Research. It's a significant premier tertiary care institute in the whole of North India, has quite a big catchment area and sees a lot of headache patients every year. So I'm working there for the last 6 years. My primary interest is stroke. I have done a clinical fellowship in that, and that's how I came to know some of you, Dr. Sacco and all. And I'm also interested in headaches, so it's always been a lifelong quest to know both of them. So I'm glad to be here.
Yes, thank you so much. Dr. Saka, our editor of the journals Cephalalgia and Cephalalgia Reports. We really appreciate her leadership, including in this reviewer academy. And we want to see what would you say, thinking back on the past year, what was the most impactful aspect of Cephalalgia Reviewer Academy? What make like most impact on your development of junior peer reviewer and why?
So first of all, the advertisement for peer reviews is very transparent. It goes out on social media. I've long been a follower and a member of International Headache Society, but to be honest, I saw that the advertisement for peer reviews was across all platforms, and so that's how I applied to it. And initial few weeks of anxiety as to where it would go, but then there was a structured interview, and then we were selected. And so it was very transparent, and I was very privileged to know that they had taken care to select people from all over the world, from different backgrounds, and that's why they really wanted to know about headaches happening at different areas. And second, once we were selected, there was a very structured training process in which they had like a proper presentation. I think Dr. Sacco and Wendy, they were there, and they took us through the steps in which they expected us to behave as peer reviewers and to approach papers that they were going to tell us. They told us that they would not be burdening us with a lot of papers and actually give us the time to get comfortable with reviewing. So that was an amazing thing. And there was structured feedback for each and every reviews that we had, where they would also ask us to, kind of look at our responses, compare it with other reviewers, like we we're talking earlier, and then when you see and you see their points and your points, and then you get to compare, you realize that there are so many aspects to a particular topic. So it was like a very closely knit family with a lot of constructive feedback. And that was an amazing thing to happen. I've never seen it happen anywhere else.
That's wonderful to hear. And I know that we spoke a little bit, and you gave me one specific aspect of feedback from the mentor that you emphasize, such as given authors who submitted very good instruction, including even one of the line, right, where to look for suggestions. Can you tell a little bit more
Yes,
about
that's
this
correct.
specific?
Yeah, so 2 points. One of them is like, when for the papers that I had been reviewing before I joined the academy, I was more of the habit of just referring to the individual lines sometimes, or maybe just talking about a concept that the authors had written and then giving my feedback on that. But then when you start reviewing and you see the pain and the meticulousness with which other reviewers have written, it's actually line by line and quoting the particular lines that the authors have written. And then when you think about it, that you are an author and you get this sort of a feedback, it becomes way more impactful rather than you getting lost as to what the reviewer wants to, be addressed from your side. That makes it so clear. So this was one where I thought that I really had to make a change. And second, there was obviously, we were told, all of us were told that even for papers where we thought they were not very important, or they were not up to the scientific rigor, we should not be very dismissive and still to maintain the respect and tell them in a very constructive way how to improve or maybe resubmit or take it a notch higher. So these inputs were amazing because they really tell you that as reviewers, we get to appreciate the hard work that the authors have put in when they submit the manuscripts. So we should treat them with respect.
Oh, we love our Cephalalgia authors and Cephalalgia report authors, and we really appreciate what you just said, because I know that even in our conversation before this video, you shared that one of main aspect it was actually learning aspect, and that we try to make articles stronger. We try to help this research, and I really like that you highlighted that being reviewer let us work on that together, including many other great researchers and specialist in medical field. And what would you say would be future direction for you?
I would like to learn more of statistics and get to review more papers because every article that I get to review gives me an opportunity to learn more and probably learning more about the way the research methodology has been devised. By seeing more and more, I would be able to formulate these nuances and help them take the important pointers and emulate them in my clinical practice and research. So learning about the statistical aspects a little more would also give me more heft, I feel, in giving those numerical values a better interpretation than I'm currently able to. So these would be my two big areas of emphasis in the coming years.
Oh, wow, it's so inspiring. Like, it's so important to have right methodology to create correct answers when we see our passions and we use this wonderful research and publications to create great treatment plan, individual patient-centered treatment plan for each of people who live with migraine and other headache disorders. I am very excited about your involvement in review of articles and staying with our wonderful group with Cephalalgia reports. We support our reviewers and our authors, and we love to invite more people to send articles to us, to watch this wonderful interview with Dr. Ray. And again, congratulations, Dr. Ray, with great achievement and completion of this Reviewer Academy with Cephalalgia. And of course, we're looking forward for your excellent reviews throughout all the years ahead. So thank you so much,
Thank you,
and
Dr.
we'll
Riggins.
see you very soon.
Thank you, Dr. Riggins. Thank you so much for making me a part of it.